What's Up, Doc Mike? Public Health on Call, by Johns Hopkins Bloomberg School of Public Health. Today's topic for February 12, 2021, an update on the impacts and opportunities of COVID-19 on schools. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Dr. Annette Anderson, a Johns Hopkins education expert, about the impact that virtual schooling is having academically and socially on K-12 students, and how she isn't sure schools will be fully open until the fall. Let's listen.
Annette Anderson, thanks so much for joining me.
Thank you, Stephanie, for having me back.
So I just read a piece from the CDC. They find scant evidence of COVID spreading in schools where there are precautions in place. Yet at the same time, they found that only 17% of school districts are fully open in person, with a quarter of them fully online. So I guess my question for you is, what is the impact of COVID on K-12 education as we know it?
Well, I think that we're seeing that there's a lot of information for families to sift through as they make their decisions about whether they're ready to go back. As much as there is information to say that schools are safe and that children don't transmit this virus, we have other reports and there are other different types of data that suggest that children are super spreaders, in fact. So I think what you're seeing is that there is just enough information on both sides that people are having to make the decision themselves about what it means for them to go back to school and in what form and what platform they would like for their students to engage.
My concern is, as a parent, that kids are not getting the same quality of instruction as they would have if they were face-to-face. I'm curious what your concerns are.
Well, I do think that there are some concerns about the quality of virtual learning. I do think that as we continue to have more students go through a virtual learning experience, it continues to improve with new innovations. And I think that there are some students that are benefiting from having a virtual learning environment. I've seen some of that in my own household. For example, I know that my children are thriving in their virtual environment, but I also know that there is a danger of thinking that all children are thriving, and that's definitely not the case. We're seeing that a number of students are having academic struggles, that they do not want to engage, that they're still 5 to 10%, even almost 10 months later, of our school students who have not engaged consistently in virtual learning or cannot be found in some cases. So we know that there are a lot of students who have been effectively locked out from their education, and we need to figure out how we can intervene for those students and bring them back so that we can intervene in this learning loss.
So this digital divide that we've long talked about, with underserved populations really not having access to technology, has really been exacerbated, because if you don't have the right technology, if you don't have internet access right now, you're locked out of school.
Exactly, which is why we really believe that the FCC has a role in helping more students get access to E-rate so that they can get access to high-speed internet. We do know that some of the utility companies have offered some internet access, but it is not high-speed internet. And it is, it's almost shameful, because our students are struggling to try to maintain, and they're doing everything that they can. We have students that are working from devices. And so we need our partners across the country who are in telecommunications to step up and make sure that our students who would qualify for free and reduced meals also qualify for free internet access and for free devices. We can do that in this country. If we can put a man on the moon, we can certainly make sure that every student in this country has access to high-speed internet.
We're going to see a lot of learning loss here, though, aren't we?
I think we would probably have seen a lot of learning loss anyway, because we don't know that their standardized tests have been paused in most districts across the country as we've just tried to figure this out. There is one study that suggested that there was some a slight decline in scores. But we know that there are other students that just have not even been assessed. So we don't really know if that gets to the bottom of the learning loss that we're expecting to see. I do think that, we're looking forward to probably next fall when everyone should have, even if we're still in a virtual learning environment, a robust assessment schedule so that we can figure out where our students are across the country so that we can make a full plan for remediation.
Okay, you just said that we could still be in virtual learning in September. How could that possibly be?
Yes. Well, I will say from a number of different factors, you've got families that are making these decisions because they know what works best for them. There are some families that say face-to-face is the way to go. I absolutely want my students back in the classroom full time as quickly as possible. You have other families that are saying, well, I like a hybrid option because I do want them to get some of that, but I don't want them to be overly exposed. You have some families that are saying, I'll wait and see. So they're kind of looking at the data and parsing it out on a month-to-month or even week-to-week basis based on the data that they're looking at around positivity, case rates, et cetera, and the teacher vaccination rates and all of that kind of information. And then you have the camp that is saying, absolutely not. Until every child and every teacher and every school can be safe, our students will stay home. So because you've got all of these different camps, districts are working hard, overtime. They're trying hard to accommodate all of these families and their disparate needs. And that's a big ask for districts to lift up, and it's a tall order for them to try to achieve in such a short amount of time. But I have to give credit to the districts that are trying to serve our students in both a remote environment as well as a face-to-face. Now, to get to your question about September, the reality is there is so much work to do to get our schools reopened that I think at this point that we might as well focus on the fall, because the vaccine schedule across the country, even for teachers or for seniors, the vaccine schedule has been very complicated. And we know that there haven't been enough doses for teachers to all get in line to get their vaccinations. And then we also know that some teachers are reticent to actually get the doses of the vaccine. And so some people are saying that they want to sit this out until they can see whether or not the vaccine is safe enough for them to return, or they're in a high-risk group and they don't know whether this is a good path for them to take as a classroom teacher. So I think we've got a lot of challenges. Districts are trying to organize this, but we have put so much on our school districts to organize and to be able to differentiate in terms of responsibilities that I think that it is best if we can start to look forward to the fall and having everyone in classrooms for the fall. The other thing is that we know that we need to have a federal data tracking system. I'm so excited that the Biden administration has said that this is a priority for them, that they're going to finally start collecting this data. I have long said that educators and public health officials need to work hand in hand in order for us to collect the data about school reopening so that the cases, as well as the best practices in schools that have opened. What have they done well? Where have there been some blind spots? What are some opportunities for us? We've got to have the data both from across the country as well as around the globe in order to be able to say with certainty what is working for our schools in trying to reopen.
I feel like teachers are getting a lot of the blame right now.
I do agree that I think teachers are being made scapegoats in some cases. I think that, it's been challenging because the teachers' unions have been trying to fight for what they know to be the rights of teachers to feel safe in their classrooms. And, the notion that some teachers are trying to figure out how to get vaccines, they don't know where to go, it's not organized by their district, it has put a different layer of stress on teachers who are also trying to teach. Some teachers are teaching one class in a face-to-face format, another class virtually, and they have the same level of responsibilities. We are trying to get 2 for 1. We haven't given teachers a pay raise, certainly. And I'm also concerned about what this means for teacher retention going into fall, because teachers are tired, they're exhausted, they are working on grace, but they need a break. And so I think that for teachers, having a clear plan about what the fall will look like would be entirely helpful for them as they start thinking about what kind of professional learning would support them going back into the classroom next year.
We talked about trade-offs. There was a story in the New York Times recently about how in Las Vegas, there's a real push to reopen the schools because there's been a rise in teen suicide. The mental health of children is really concerning right now. I know my son's been in the basement for a long time. Talk to me about that.
Well, first, I'm sorry that your son is in the basement.
He's a high school junior studying in the basement.
He's studying in the basement. So I do think that, we've got to go back to this notion, as I've said, that one size does not fit all. And that there's a lot of gray between every school must reopen, by a certain date. And, we're going to stay fully remote. And in that gray space between the two, I think there's a lot of opportunity for innovation that we need to really think about. And so some schools have continued to embrace this hybrid approach, and maybe some schools are not fully ready to go back to a fully face-to-face model. But I think that, as schools are looking at what has been working and where they've been most successful, we're going to continue to see the kinds of innovations that we need that will become best practices. Make no mistake about it, Stephanie, we are not going back to the school of March 2020. That is over. That's not coming back in many cases. And we need to be okay with that. I think we need to mourn that. And I think we need to embrace what is ahead of us, the opportunity that presents for us, and think about how we make our country better, how we make our classrooms better, how we make education better, because we're willing to embrace new ideologies around education.
How will it be different?
I think it will be different because I think we'll first of all be training our teachers to teach differently, which is exciting. I think we've had this kind of model of teacher education for the last 50 years that really has not innovated very much. And I think that we need to think about how we can be more constructivist in that approach. We've relied a lot on paper and pencil to get the work done in many of our schools. And I think that we are now seeing that digital technology allows us to dream bigger. So I think that's one way. I also think that you're going to see socially distanced classrooms for days and weeks and years to come. I don't think that that's a trend that's going to go away. So that's going to affect class size, which could be a good thing if we have enough teachers to pull that off, because we know that smaller class sizes mean more individualized instruction, and that would be amazing. We're also seeing that districts are doing a yeoman's job in terms of providing additional resources to families, from food to housing supports. We know that there are about 9 million households right now that are possibly at risk of eviction. And so we know that that's something else that this administration has got to support, because housing policy is education policy. And so seeing that we're able to address and get ahead of this foreclosure crisis and this looming eviction crisis is going to mean that we're going to keep kids safe. So I think our schools have tried really hard to be responsive in that. We also need to have more nurses in our schools. So if anything has gotten a shake out of this, I also think that it's been that we don't have enough school nurses. There are some schools that don't have any nurses full-time at all. Some have a part-time nurse, and some schools have a home health aide. And so we know that we're going to have to get more health personnel into our schools to help to continue to manage this for time to come. So schools will continue to innovate, and they will look differently. This is going to force our budget structure around education and how we're funding education to be looked at differently, to make sure that we have enough supports for students to allow them to be successful. We also need to be thinking about school schedules. One of the things that we've seen is that for some of our students, because they've had families that have needed support financially, we've had students that have had to go to work. So we have high school students that are right now at work trying to figure out how to be online and be in virtual school and also work at the same time in some cases. Or sometimes they're logging on in the morning and then going to work in the afternoons. That means that school districts are having to think differently about how they're scheduling students to accommodate that. So I think, but I think that we can do that. We can allow our students to be successful if they're needed in the workplace, if they're developing the kinds of skills that allow them to onboard into a career track and to think about vocational training as a part of this experience. I think I would be pushing for that, because it allows us to have new options for students that didn't really exist before. So it has pushed us in ways that we hadn't expected.
And my last question, I guess, is academics. How will our kids catch up after this?
Well, I do think that, we have to think intentionally about what we want to do to make sure that our students can catch up. For example, I've said we've needed to get a common assessment to make sure that we know where the floor is, where our students are. And so once we have that information and we can compare it to other years of data that we have, I think then we'll know how deep this learning loss is or where there might be gains. I think that until we can get some similar assessment data and then track that against some of the collection of data that at the federal level is looking at where schools have reopened and how, it's hard to draw real conclusions about what the learning loss has been. I do think that most of us who are in education expect there to have been some significant loss, particularly because 5 to 10%. I think people don't understand how staggering that is. 5 to 10% of our students have not regularly engaged since the pandemic began. And we don't have a mechanism to find those students. The other thing that has happened as a result of the pandemic is that you'll see that across the country, there has been a drop in enrollment in schools. On the other end of the spectrum, the drop has happened mostly in pre-K and kindergarten. Many families have chosen to sit out the year because they just have said that they would rather them stay at home than to try to engage a virtual kindergarten or pre-K year. And so we have to figure out what we're going to do for those students because now they will become rising first graders and kindergartners, and we have to have some mechanism in place to assess their learning and the capacity to intervene for those students to make sure that they can still meet the gates. So you may have heard me talk about the importance of these gates. At kindergarten, it's around executive function. So we need to make sure that our kindergartners are still going to be able to meet that kindergarten gate well. And then at third grade, it's third grade literacy. So if we have students that are potentially pre-K students that have been the focus, especially in some of our more vulnerable communities who are missing 1 or 2 years even of active engagement in school, we need to figure out what we have to do to make sure they can still meet that third grade literacy gate on time. And then the third gate that I talk about is the 8th grade algebra gate, which builds on math skills, strong math skills over time. And so for the students that have been disengaged or students, particularly in kindergarten and pre-K that have not been actively in school, we need to think about how we make sure that they can still get to their gates.
Annette Anderson, you've given us a lot to think about. Thanks so much for joining me.
Thank you, Stephanie.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.